So a man that's undergone a radical prostatectomy, what are the options that he has as far as treating his condition?
Well, the options that have been advocated by several centers are not really fully supported by much of any data, unfortunately. The field of penile rehab is a lot of speculation versus real data. Very few randomized trials have shown benefit of one over the other. Now, the options that are available and are mostly advocated is, use of PDE5 inhibitors, which are the brand names like Cialis, Viagra, whether on demand or on a daily basis. The other options are use of injections, which is a drug that is injected into the penis to provoke vasodilation of the blood vessels. And the other one is vacuum-assisted devices, which have been shown to be helpful in preventing shrinkage of the penile length, to create an erection and constriction by placing a band. These are the three main options that have been advocated. Recently, in the urological community, we're looking at the role of nerve stimulation itself, which is if it's a nerve injury, why not stimulate those nerves for them to regenerate and wake up earlier? And that's where the concept of penile vibratory stimulation lies. Interestingly, the nerves that are injured by surgery are not involved in the nerves that we are stimulating by the penile vibratory stimulation. The nerves are called pudendal nerve. And pudendal nerve is considered the king of pelvis. And these nerves are the sensation of the penis, and they also have a role in contraction of the muscles that are responsible for rigidity of erection. These nerves can be stimulated on a regular basis to create stimulation of the nerves that are injured, and this is an indirect reflex activity that is part of our human physiology. So recently we are looking at a very, very easy way of stimulating the nerves and allowing the nerves to wake up faster, and that's called the concept of penile vibratory therapy.
So, can you explain to me, in a man who's using penile vibratory stimulation therapy, how exactly does it work?
Well, think about it this way. Men, as soon as we're born, we realize that touching the penis is a very important part of our life, whether it's hand stimulation or part of our sexual activity with our partners, where we do repetitive stimulation of the nerves. Repetitive stimulation means back and forth movement, whether it's with the hand or with the vaginal or oral or whatever we use.
So
Why is that?
we're using very polite phrases here. What we're talking about effectively is masturbation and oral sex and normal vaginal sex. That's what you're
Exactly,
talking about.
exactly. So what happens is these nerves, they are part of our evolution. If you look at how horses and dogs and other mammals have sex, they do repetitive back and forth movement. These nerves need to be stimulated for erection to occur and for your orgasm to occur. Penile vibratory therapy has been used for almost more than a century for treatment of orgasmic dysfunction and sexual dysfunction in women, very successfully. And recently, in the past 3 decades, it's been successfully used for men with spinal cord injury who have absolutely no sensation of the penis whatsoever. But vibratory stimulation can actually provoke sexual reflexes that are located below the level of their lesion to activate erection, activate orgasm, activate other unforeseen, things that happen, like relaxation of their legs and increased bladder capacity and many other benefits that are completely physiological.
That's
Now,
quite remarkable what you just said. that men with spinal cord injury are able to use penile vibratory stimulation, given that most of us expect that you know, there's, as you said, there's no sensation. That's quite an astonishing fact.
Absolutely. The neurophysiology of erection is still a very untapped territory, Patrick. Um, we are there are many, many studies that are coming out of many amazing centers of excellence talking about how the dorsal nerve of the penis, which is a simple nerve that is so amazingly connected to centers of our brain and spinal cord that have to do with almost everything, whether it's emotion, whether it's hormone production, whether it's testosterone production, love hormone production. These nerves directly stimulate those centers. There was a very interesting study that men who have severe PTSD, which is post-traumatic stress disorder, and depression, erectile dysfunction, have a very hyperactive part of their brainstem called the cerebral cortex, which is the amygdala. And the studies have shown that by stimulating the penis of study subjects, you actually can shut down these depression and anxiety and PTSD centers by just stimulating the penis. We don't know much about neurophysiology of the penis, but what we know is that it's incredibly amazing.
I have to say, when I read these studies, I'm absolutely gobsmacked at how little we actually know and how much we're discovering almost on a daily basis. I'm just wondering if I could take you back just a little bit when we were talking about how penile vibratory stimulation, or PVI, works. We also, earlier in this interview, we were talking about the role of the neural transmissions, the arousal, what's going through the brain, the spinal cord, and the reaction that takes place in the penis. How, from a perspective of PVI, how does this, PVS, I should say, how does this all connect together? The brain, the spinal cord, all that sort of thing.
Perfect. One of the most important neurotransmitters for erectile function is called nitric oxide, which is what is a neurotransmitter is signals coming from your central nervous system. Neurotransmitters increase activity of our tissues, whether it's muscle contraction during walking, or whether it's crying or sweating. These are neurotransmitters that secrete, that allow our body's organs to function. In the penis, nitric oxide is one of the most important neurotransmitters that has been shown to play a major role for erectile function. Now, like for example, these medications that we are very well aware of, like Viagra, Cialis, Levitra, they keep nitric oxide longer in the penis nerves to allow the blood vessels to continue to remain open. Now, we all know that multiple studies have shown that penile vibratory stimulation actually increases nitric oxide activity in the penis. So it's like almost taking Viagra by allowing more nitric oxide to be in the penis. Viagra, on the other hand, cannot do a thing if there is no nitric oxide in the penis. So if there is no stimulation, and we all know this, if you just take Viagra and sit there and watch, CNN or, news, nothing is going to happen. That vibratory stimulation increases nitric oxide activity through reflexes. And we all know this. When we are touching the penis during masturbation, we notice there is increased girth of the penis and eventual erection. Now, this problem is different in men with ED. You need to have a lot of stimulation, and you probably cannot reach that level of stimulation with the hand. I see many patients, Patrick, and I'm sure you do as well, who come in and say, "Doc, I had prostatectomy a year ago with really intense hand stimulation, I can really get a decent erection, but I get tired and I can't reach the level of rigidity that I want. And that's
They also
part of
do
it
themselves
is
damage trying to do that as well. Like in
exactly.
some
So, I
cases, they
mean,
get micro tears in the penile shafts, and they get a lot of soreness.
exactly, because they are being a little bit difficult to for hand. Now, the concept of penile vibratory stimulation is to stimulate specific mechanoreceptors, which is basically the antennas that are located on the surface of the penis. These mechanoreceptors are act rapidly firing, and what they need is a very high frequency and amplitude stimulation, which the two major vibrators that are now in the market that can reach that level of stimulation to basically easily stimulate these centers. And the two devices that are approved for medical use are the Vibrect and the FertiCare. The FertiCare is a device that is approved for provoking ejaculation in men with spinal cord injury. The Vibrect has two versions. One is approved by the US FDA, Health Canada, European Union, and Australia for provoking penile erection in men with ED. Now, that could include prostatectomy patients. It could be anybody with erectile dysfunction. And we also have another version for which is called the Vibrect X3, for which is stronger for adequate stimulation for ejaculating men with spinal cord injury.
So when in a man who's using vibration stimulation, um, why would they use vibration stimulation as opposed to just the normal treatments like Viagra, Cialis, or even injections? If they've undergone a prostatectomy, what's the difference going to be by using a device like a Vibrect for vibratory stimulation as opposed to staying on the more traditional treatments that the majority of
Well,
urologists know of, but they haven't extended their knowledge to include PVS.
well, in studies that have been done, PDE5 inhibitors have not really shown to enhance recovery of spontaneous erections. Remember, what we're talking about is, how are we going to help a person after prostate surgery to hopefully in a period of time return to a spontaneous natural erection not dependent on Viagra or other medications? Number one. Number two, what does Viagra has shown? We have to look at evidence. Viagra and Cialis have shown that they help with preserving smooth muscles in the penis. They do not at all show any evidence of whether they increase nerve regeneration and functional recovery of nerves. And that's something that Viagra does. Vibrect does. Vibrect stimulates the nerves. Of all the treatments that are available for post-prostatectomy, Vibrect is the only treatment that addresses nerve dysfunction, which is what the original problem is, by stimulating the nerves. Now, if a person masturbates 2 to 3 times a day, they can still benefit. But I believe with a more focused stimulation, it's much easier and much better and more focused.
So based on what you've said about nerve regeneration and we've talked about the damage to nerves and the erectile problems, how soon should a man start using vibratory stimulation? Should he think about using it before his surgery, after his surgery? How soon? Ideally, what should be the time frame, and realistically, when should a man start using it?
Ideally, in my opinion and opinion of many sexual experts who use vibratory stimulation, is to start it 2 to 3 weeks before the surgery is done. Why? The reason is they need to experience the stimulation of the penis by the vibratory therapy before the nerves are injured, so they can mentally return to that state an expectation of what can happen, the cascade of events that occur during the stimulation. Number two, right after surgery, men develop some elements of urinary incontinence, and they are more worried about return of urinary control and dryness than anything else. So they kind of put the erectile rehabilitation on the back burner. In my opinion, start early, start before surgery, and empty your bladder and do vibratory stimulation absolutely every day, or at least 4 times a week in a sexual setting. So start as soon as possible.
So two questions I have for you. When you say as soon as possible, are you talking about as soon as the catheter is removed?
Exactly. As soon as the catheter is removed, and maybe a couple of days to make sure that you don't have any urinary tract infection or burning, then begin the therapy. The therapy is extremely painless. It's actually very pleasurable, and it actually produces very strong orgasms. So it has a positive reinforcement. And if you ask patients who use vibratory therapy as soon as possible, they even tell you they get 30, 40, sometimes 50% fullness and erections right away. Not rigidity yet, but the head of the penis and the rest of the shaft really engorges with blood. And in my opinion, I think this is very beneficial with oxygenating the penis, as we discussed.
You also mentioned the phrase in a sexual setting. What did you mean by that?
Well, the sexual setting is, I would say in a reenactment of mental thoughts, perhaps with a partner, or watching visual stimulation, such as pornographic material. I always tell my patients right after surgery to do not become distant with their partner. Be close, be sexual, be kinky, whatever is possible. Studies after studies have shown that sexual stimulation after surgery by patient's partner, a motivated partner, enhances recovery of erections. And I tell them, the first thing I tell the patient is to buy a vibrator or a dildo for his wife and make love to each other without sexual intercourse. Make love to her, whether with hands or with a vibrator, and be close. Let her stimulate you, and be close at least 2 to 3 times a week.
I've got a question here in terms of at what stage is it too late to use vibratory stimulation? If you're a man who's listening to this right now, or someone who cares for a man who's undergone a prostatectomy, but perhaps maybe 2 years ago or longer, 5 years ago, is it too late for those men?
We received testimonials from men who have had surgery even in the late 1990s, and they have had moderate to severe erectile dysfunction, and they use the Vibrect religiously, and they notice the improvement in their rigidity and erections. I believe it's never late to use nerve stimulation. Remember, Patrick, erectile function is a complex activity, and multiple studies have shown that the nerves that are injured after surgery are not the only nerves that are absolutely responsible for erection. There are nerves that are not even in the field around the prostate that are still very contributive to our erectile function, such as the pudendal nerve that I told you. So men who have had surgery several years ago and maybe the nerve was completely destroyed or they had the nerves removed, they can still somewhat benefit. Now, with understanding and expectation that it's probably going to be less successful than someone starting it as soon as possible, but still they can benefit.
In what way will they benefit?
They can benefit with potentially strengthening the muscles like a workout that are really deep in the pelvis, that are responsible for rigidity of erection and preventing the blood from leaving the penis. As I mentioned to you, Patrick, many men after prostatectomy, they eventually develop venous dysfunction where the blood doesn't want to stay in the penis, and that's why they cannot get rigid and firm. And men who use vibratory stimulation or very strong Kegel exercises, the stretch exercises that are recommended by doctors, they can strengthen these nerves and perhaps improve venous dysfunction. Another problem that post-prostatectomy patients develop is orgasmic dysfunction, poor orgasms, low-intensity orgasms, and painful orgasms. And these three things, I believe, they can be helped with vibratory stimulation.
So even in men that had their surgery, as you said, in the late 90s, have they been able to reach orgasm using vibratory stimulation?
Yes, most men using Vibrect develop excellent orgasms, and that's one of the benefits of a high frequency and amplitude device, is that you stimulate enough to reach orgasm. Regular vibrators that are used for shoulder and female vibrators don't produce enough frequency and amplitude to provoke ejaculation and orgasm.
What about men that have undergone alternate treatments such as brachytherapy, seed therapy, or even hormone therapy, what's commonly called androgen deprivation? Can vibratory stimulation help these people?
I believe that any of the treatments that you mentioned still develop nerve dysfunction and injury to the nerves, whether it's a slow process or a fast process. We are not intensely studying patients after radiation to use vibratory therapy, but many patients purchase it after radiation and they use it. I do not see any contraindication for using it, but remember, post-radiation erectile dysfunction is a combination of damage to the vessels and damage to the nerves. And it's a progressive problem that may not begin right away and could lead eventually to permanent dysfunction. I would say to your audience that if a person has severe, complete erectile dysfunction and that lasts at least 2 years after radiation, they probably will need to use more invasive therapies like penile injections and penile prosthesis.
I'm regularly asked about more commonly prescribed methods of treatment, namely the medications we talked about, the PDE5s, which include Viagra, Levitra, and Cialis. Now, it's fairly common for men who have undergone a prostatectomy to be prescribed 5 milligrams of Cialis, for example, these low dosage or low strength PDE5s for daily use. My question is, are these men wasting their time with these medications at these low strengths? And when I ask this question, I'm asking, what's the evidence to support daily usage of low strength PDE5s?
Very interesting question. Recent data presented at the American Urological Association in May of 2013 showed that there is no evidence of daily use benefit versus on-demand use. The on-demand use is taking a higher dose of the Viagra or Cialis and attempting sexual intercourse versus taking it daily. I believe a frequent use of Viagra or Cialis is beneficial for preserving the smooth muscles. And in my practice, I recommend taking 100 milligrams of Viagra before vibratory stimulation at least twice a week, or at least 4 times a month. Whether it depends what they're seeking. Are they seeking that taking the 5 milligrams of Cialis or daily Cialis, are they expecting to have an erection adequate for sexual intercourse, after prostatectomy in the first few months? I don't think that's a good expectation.
I think in the
Very, very,
majority of men that are taking the low strength, as I said, like the 5 milligrams of Cialis, and I'm not just pointing the finger at Cialis, you know, Viagra and Levitra, the same thing. Um, they're prescribed these tablets that they take on a daily basis, and I think
there is
they're
no
under.
data, there's no data supporting what is the expected outcome? Is it a
I
spontaneous
think they're just
erection?
following. I think they're just following instruction, and that they're told that if they
I,
take these on a daily basis, within 12 months, their erections will return.
that is not, the data is not supporting that at all. Taking daily Cialis has not shown to improve and enhance recovery of sexual function.
Okay, so this then brings me to my next question, which is a really important question for a lot of men who are struggling financially to stay on top of medication and penile rehabilitation, treatment. Now, I don't know what it's like in the US, but a quick review of some pharmacy websites over here in Australia show that 5 milligrams of Cialis, 28 tablets of 5 milligrams Cialis, costs approximately $160 Australian, or in 100 at the time of this recording, it's about $150 US. So my question to you is, does it make more sense both therapeutically and financially for them to use daily vibratory stimulation therapy instead of the PDE5s? Does it make more sense both therapeutically and financially for them to use daily vibratory stimulation therapy instead of daily PDE5s? And instead just to
Um,
use the PDE5s, the maximum strength PDE5s solely for penetrative sexual purposes?
it makes sense to me, but we're waiting for the randomized clinical trials from several centers in the United States to show how vibratory stimulation uh, helps with recovery of nerve function. But preliminary data shows that men who use vibratory stimulation on a daily basis or at least 4 times a week have a 6 months to 9 months earlier recovery of sexual function and spontaneous erections. If a person has a limited budget and they want to use the cheapest method, obviously the cheapest method is a vibrator, obviously, because doesn't involve medication, doesn't involve prescription. It's something you just plug in and you use. So I recommend to your audience, get a vibrator and begin using it every day religiously. It's not going to hurt anything. It's only going to help with their recovery. As far as taking the pills, in my practice, I again recommend taking the Viagra, 100 milligrams or 20 milligrams of Cialis. If
Which are
they
the
want
full
to take
strength
it,
ones. Those are the
full
full
strength,
strength. Yep.
take it half an hour before vibratory stimulation. Why? Because if you take it without any stimulation, you're basically wasting your money. I guarantee you, you might as well throw it in the trash. You need to stimulate. So what I tell my patients is take the Viagra or Cialis and stimulate like crazy 20, 30 minutes afterwards using a vibrator, or masturbate, or whatever you have to do. The goal is to stimulate to increase nitric oxide for the Viagra to keep in the first place. So in my practice, I tell them to take about 4 Viagras a month, or 4 Cialises a month if they can't afford them more frequent.
In the case of the vibrator that you're talking about, let's talk about that.